We often think of milk as just, well, being there, a natural, continuous flow, right? But what happens when that flow stops, or maybe never even starts? When a cow, physiologically, should be producing milk but isn't. Today, we're taking a deep dive into cattle lactation failure, and this is a huge challenge, costing the U.S. livestock industry roughly, $1 billion annually, just for reproductive diseases and conditions linked to this very issue. You've shared a wealth of sources with us, everything from comprehensive analyses to really cutting edge research on diagnostics, management. And our mission today is to pull out those crucial nuggets of knowledge for you. We're going to explore how seemingly unrelated issues connect, uncover some of those hidden costs, and see how new technology is really transforming how we approach animal health. So when we talk about lactation failure, that sounds like kind of a blanket term. Is it really one single issue, or are we actually talking about a spectrum of problems?
Yeah, you've hit on a crucial distinction right away. Lactation failure isn't just one thing. It shows up in a few distinct ways. First, there's agalactia. That's the complete absence of milk production in an animal that, should be lactating. This can come from severe systemic disease, maybe primary endocrine issues, or even specific problems with the mammary gland itself. For instance, Mycoplasma agalactia, that's a known bacterial cause that can lead to the udder actually atrophying and a total stop in milk production.
Oh, complete atrophy. Okay.
Then you have hypogalactia. Now, this means an inadequate or reduced milk supply. Some milk is there, just not enough. This is actually pretty common, especially in young cows or premiparous ones, that's first milking cows.
Yeah.
And it's often linked to things like malnutrition, maybe advanced age, or other mammary gland disorders.
Okay, so no milk or not enough milk. What else?
And finally, a really significant category is mastitis-related milk loss. This is inflammation of the mammary gland, usually because of microbial infections. The critical point here really is that the tissue damage from the mastitis can account for up to, 70% of the associated milk losses. It's substantial.
70% just from the damage.
Exactly. And within mastitis, we need to distinguish between clinical mastitis. That's where you see obvious signs, right? Changes in milk color, clots, maybe utter swelling and pain. And then there's subclinical mastitis. Now, this one's hidden. There are no overt signs, but milk production is significantly down, and there's a measurable increase in the somatic cell count in milk. What's truly fascinating, or maybe alarming here, is that while clinical mastitis is obvious, subclinical mastitis actually accounts for the majority of economic losses.
The hidden one costs more. How?
Because it's chronic, and it's so widespread. It's just this silent drain on productivity day after day.
That idea of a silent drain is really impactful. Okay, so we know what lactation failure looks like now. But to understand why it's so damaging, we probably need to appreciate just how complex milk production is physiologically first, don't we?
Absolutely. It really is a marvel of biology.
Yeah.
It's all controlled by this delicate hormonal balance. It starts way back with mammogenesis, that's the mammary gland development. This is influenced by hormones like estrogen, progesterone, prolactin, somatotropin, all throughout the cow's life, but especially during pregnancy. As gestation progresses, these milk-producing structures, called alveoli, they develop extensively, getting ready.
Okay, so the hardware gets built.
Right. Then comes lactogenesis, the actual initiation of lactation. This is when the mammary gland functionally transforms into a milk-secreting state. It's triggered mainly by a rise in prolactin and adrenal glucocorticoids. And this is crucial. It coincides with a critical drop in progesterone right around parturition or calving. This is also when colostrum accumulates. That's the antibody-rich first milk, which is absolutely vital for the calf's immunity.
That first milk is so important.
It's essential. Building on that, after calving, you have galactopoiesis. That's the maintenance of lactation. This ongoing milk production depends fundamentally on consistent milk removal. So whether it's the calf suckling or machine milking, hormones like prolactin, growth hormone like BST, bovine somatotropin, and thyroid hormones are pivotal here in keeping it going.
And then there's the letdown process, right? The milk ejection reflex. It sounds like something that should just happen automatically, but from what I understand, it's actually incredibly sensitive. How exactly does that work, and what can go wrong there?
Yeah, it is incredibly sensitive. It's a neurohormonal reflex. So nervous stimuli, things like udder massage, the sight or smell of the calves, even the sound of the milking equipment sends signals up to the brain. This triggers the release of oxytocin into the bloodstream. Oxytocin then causes the cells around those alveoli in the udder to contract, forcing milk down into the duct so it can be removed.
Okay. Stimulus, brain, oxytocin, milk. Simple enough.
Almost. But here's the critical part. Adrenaline, the stress hormone, directly inhibits oxytocin's action. It reduces blood flow to the mammary gland. Less blood flow means less oxytocin reaches the target cells, and that impairs milk letdown.
So if adrenaline literally blocks milk flow, wow. That means cow comfort and keeping a stress-free environment aren't just, nice to haves for animal welfare. They're directly impacting the milk check, the profitability.
Exactly right. It's not just about feeling good, it's about physiological function.
What are some of those maybe overlooked sources of stress on a farm that could be quietly messing with milk letdown?
Oh, it can be subtle things sometimes. Loud noises, maybe unfamiliar handlers, sudden changes in routine, even aggressive social dynamics within the herd if there's overcrowding or competition.
Yeah.
All these things create stress, they elevate adrenaline, and you can see a significant drop in milk yield, even if the cow seems perfectly healthy otherwise. And if we connect this back to the bigger picture, lactation isn't this isolated process. One of your sources puts it perfectly. It's presented as a direct result of having a successful reproductive program.
Okay, so reproduction first, then lactation.
Exactly. Which means disruptions in fertility or problems during calving will invariably impact milk production later on. Think about that problems like dystocia, that's difficult birth, or general infertility. They aren't just fertility issues in a vacuum. They are direct precursors to lactation failure down the line.
Wow. It really sounds like this incredibly complex web where, everything affects everything else.
Yeah.
So if it's not just one thing, what are the main categories of culprits behind lactation failure when you sort of zoom out?
It is absolutely a multifactorial problem, lots of complex interactions.
Hmm.
But we can break it down into some key areas. First up, you've got infectious causes.
Okay, like bugs.
Right. Mastitis pathogens are a major direct cause. They inflame the udder. We're talking common culprits like Staphylococcus aureus, which often causes these stubborn chronic infections, and Streptococcus agalactiae, known for forming biofilms that are hard to treat. But then you have the really challenging ones, like Mycoplasma bovis. That can cause severe mastitis. It spreads rapidly, often doesn't respond well to antibiotics. And subclinically infected animals, those not showing signs, are often the source spreading it through the herd. Other bacteria like E. coli, Klebsiella, Streptobarus, and Truparella pyogenes. That last one often causes this foul-smelling pus. Especially in heifers or dry cows, they can all cause significant problems too.
Okay, so direct udder infections. What else?
Well, moving slightly away from the udder, reproductive tract infections also play a major role. Now, they don't directly stop milk production in the moment, but they hammer fertility, which leads to reduced lifetime milk production for that animal. For example, chlamydiosis. Subclinical infections are really widespread and can actually be economically more significant than the acute outbreaks because they just linger. And interestingly, vaccination against chlamydia abortus, the one causing abortions, has been observed in cattle to actually decrease milk somatic cell numbers.
Wait, hang on. A vaccine for a reproductive issue can actually improve udder health, reduce somatic cell counts. That's a surprising connection.
It really is, isn't it? It just highlights how interconnected these physiological systems are. You treat one thing, and you see benefits elsewhere. Other reproductive infections include things like leptospirosis, campylobacteriosis, trichomoniasis, and viruses like IBR, infectious bovine rhinotracheitis, and BVD, bovine viral diarrhea virus, both common causes of abortion. There's also Neospora, which is a protozoal disease causing fetal losses, and of course, brucellosis. And finally, don't forget severe systemic infections. Even something like highly pathogenic avian influenza, HPAI, H5N1, when it jumps to dairy cows, can dramatically reduce milk production.
Okay, so infections are a huge piece. What's next?
Next, we absolutely have to dive into nutritional imbalances.
Right, and I suspect it's more complicated than just feeding them enough, right? It's got to be about the balance.
Absolutely. Precise balance is key. Energy and protein balance, for starters. Negative energy balance, or NEB, is really common in early lactation when milk output peaks and energy demand skyrockets. This can lead to anostrus, that's the absence of heat cycles and ovarian cysts. But here's the twist. It's not just underfeeding. Overfeeding, especially energy in heifers before they calve, can actually reduce the amount of functional milk tissue they develop.
Really? Feeding them too much can reduce milk potential.
In heifers, yes. And in mature cows, overfeeding energy can increase the time it takes from calving to their first ovulation, so it delays breeding back. Protein deficiency, that can delay puberty and cause silent heats where they cycle but don't show it. But excess protein can be toxic to sperm and ova and impair embryo development. It's all about that balance.
It's a real tightrope walk nutritionally.
It is. Then there's a whole alphabet soup of key mineral and vitamin deficiencies. Calcium, for instance. It impacts rumen function, uterine tonicity, muscle tone, insulin production, and of course, milk yield directly. Selenium deficiency compromises the immune system, increases risk for mastitis and metritis, which is uterine infection. Other crucial minerals include phosphorus, zinc, copper, iodine, and vitamins A and E are vital. Vitamin E is a key antioxidant, and if it's deficient, mastitis risk goes up.
So many specific nutrients playing critical roles.
And we can't forget mycotoxin contamination. These are fungal toxins that can sneak into feed. They reduce feed intake, they impair metabolism, disrupt hormones, and crucially, they suppress the immune system, making cows more vulnerable to everything else we've talked about. Specific examples. Deoxynivalenol, or DON, reduces milk production. Zearalenone, ZEN, can cause abnormal udder development. Aflatoxins can leave toxic residues in milk and damage the liver. And there's even evidence that dioxin, another contaminant, can directly block lactogenesis itself.
Wow. So optimizing nutrition isn't just about providing calories, it's like arming the cow's primary defense system.
Precisely. It's fuel for milk, yes, but it's also a primary defense mechanism against disease and a cornerstone of reproductive health. It touches everything.
Okay, infections, nutrition. What's the next big category?
Moving on, we have hormonal and endocrine dysfunctions.
Right. So beyond that direct stress response with adrenaline, certain more subtle hormonal imbalances can totally derail the whole milk production process too. How do these fit in?
They absolutely can. A deficiency in prolactin, for example, directly causes lactation failure. Simple as that. As we discussed, oxytocin is critical for milk letdown, and its action gets blocked by adrenaline from stress. We also use bovine somatotropin, BST, commercially, to increase milk yield in many dairy operations, so hormone levels are actively managed there. Then you have reproductive hormonal imbalances playing a part. Things like endocestrus, the lack of cycling, or cystic ovaries, which are often due to altered LH release from the brain, delayed ovulation, or anovulation where they don't release an egg. All these lead to infertility, which, as we said, impacts lifetime milk. Even thyroid hormone deficiencies or hypothyroidism are linked to irregular cycling, lower conception rates, retained placentae after calving, increased mastitis, and even hoof diseases.
It seems like the body's signaling systems are just incredibly sensitive.
They are. And remember, the high metabolic demands of producing all that milk can themselves be a physiological stressor. It just reinforces that whole idea. Cow comfort and low-stress handling aren't optional extras. They are direct determinants of milk production and reproductive efficiency.
That makes perfect sense. The body's under immense pressure just to produce, and anything that tips that delicate hormonal balance can have a huge ripple effect.
What about genetics? Is there a component to this susceptibility that's literally bred into the animal?
Definitely. There's a strong genetic predisposition component. You can have heritable conditions like just poor genetic merit for fertility traits. This might show up as excessive body condition loss after calving, or delayed return to cycling, or increased susceptibility to endometritis. There are also specific genetic defects. There's a mutation in the TMM95 gene known to cause subfertility in bulls, and conditions like X trisomy, that's an extra X chromosome in females, are linked to infertility. Even cystic ovaries can have a genetic component.
Okay, so some animals are just genetically more prone.
Yeah.
You mentioned something earlier about breeding choices. Ah, yes. This is where it gets really interesting, looking at the unintended consequences. Historically, there was intensive selection solely focused on maximizing milk production volume.
More milk, more milk, more milk.
Exactly. And that focus, while successful in increasing yield, inadvertently led to a decline in fertility and general health traits in some high-production breeds. There was this surprising study cited in your sources comparing modern Holsteins to dairy cows with genetics from, get this, 1964.
Wow, from the 60s.
Yeah, and those 1964 genetics cows actually showed a more robust innate immune response and were better at clearing mastitis infections compared to the modern high-yield Holsteins.
Wait, so you're telling me cows from decades ago actually had better natural immunity than some modern ones? That's truly shocking. It sounds like we might have inadvertently traded some resilience for sheer production volume through those breeding choices.
That's a fair assessment of what happened historically in some lines. It's a powerful lesson, and it raises that important question: how do we achieve balance?
So how do we balance it now?
Well, the good news is modern genomic selection tools are much more sophisticated. Now, the aim is for both high production and resilience. We can select for superior immune function, better fertility, and robust reproductive performance right alongside milk yield traits. It's about breeding a more balanced, healthier animal overall.
That's good to hear. Okay, genetics is a piece. What's left?
Finally, we have management and environmental factors. These wield huge influence.
Right, so we've covered the internal biology, the genetics, but what about the day-to-day life of the cow? How much do external factors and, frankly, how we manage them truly influence all of this?
They play a massive role. Let's talk stressors. Heat stress is a big one, especially in warmer climates. It significantly reduces feed intake, milk yield, conception rates, and increases the risk of early embryonic death. Handling and transportation stress can be very detrimental, particularly risky during early pregnancy. And simple things like poor social dynamics or overcrowding, think competition at the feed bunk, reduce feed intake and increase overall stress levels.
Little things add up.
They really do. And then there's calving management and dystocia difficult birth. This is critically important. Common causes include a mismatch in size between the fetus and the dam, especially common in first calf heifers, or the fetus being in an abnormal position for delivery. Now, some level is expected, maybe 10–15% of first calf heifers need help, 3–5% of mature cows. But the sources mention that in some dairy herds, over 50% of first calf heifers might require assistance.
Over half. That's staggering.
It is. And the impacts are severe. For the calves, you see increased stillbirths, more sickness like respiratory disease and scours, higher mortality rates. Calves born from difficult births are often weak, slow to suckle, and have impaired passive immunity because they don't get enough colostrum quickly.
And for the mother cow?
For the dams, the long-term impacts are significant. Increased risk of uterine diseases like retained membranes or metritis, ovarian dysfunction, delayed uterine involution, that's the uterus shrinking back to normal size, extended periods of anostrus. All of this leads to decreased fertility, definitely reduced milk production in that subsequent lactation, and a much higher risk of being culled from the herd prematurely. Plus, there's the risk of physical trauma during the difficult birth itself.
So dystocia isn't just an immediate stressful calving problem. It casts this long shadow over subsequent lactation success and the cow's entire productive life. That makes it a really critical control point for profitability, doesn't it? Both dairy and beef.
Precisely. Managing calving well is absolutely key. And then, of course, just fundamental hygiene, biosecurity, and housing conditions matter. Inadequate hygiene increases the risk of reproductive tract issues. Robust biosecurity things like quarantining new animals for a good 21–30 days, controlling movement, regular sanitation is essential to prevent disease spread. Even the housing system influences fertility. Generally, loose housing systems tend to be better than tie stalls, for example, and poor ventilation or high humidity in barns can increase the risk of mastitis and lameness.
It's just layer upon layer of factors. So with all these complex, interconnected things, it must be incredibly challenging to pinpoint the exact problem when lactation failure occurs. How do veterinarians and producers even begin to diagnose it?
It really requires a multi-pronged approach, doesn't it? You're integrating that clinical observation, the hands-on stuff, with more advanced science. You start with clinical examination and on-farm assessment. This means careful observation. Are there visible milk abnormalities suggesting mastitis? Are the udders underdeveloped, or is there just a lack of milk suggesting agalaxia or hypogalactia? Are estrus cycles irregular? For dystocia, you look for those prolonged labor signs, like a cow actively straining for maybe 1–2 hours with no progress, or maybe 2–3 hours for a heifer. That's a sign intervention is needed. We also use body condition scoring, that visual 1–5 scale, to assess nutritional status. The ideal BCS at calving is typically around 3.0 to 3.25 for dairy cows.
Okay, so eyes on the animal, condition scoring, what else?
Rectal palpation and ultrasonography, US, are crucial tools. Palpation can diagnose pregnancy usually from 30 to 35 days. Ultrasound is even earlier, maybe 26–29 days. Plus, it lets you check if the fetus is viable, has a heartbeat. And both methods are key for assessing infertility, looking at ovarian structures, checking uterine health for signs of infection or other issues.
Right, the standard vet checks. Then you move into the lab.
Exactly. Then we move to laboratory diagnostics. Milk-based tests are common. Somatic cell count, SEC, is the primary indicator for subclinical mastitis. The California mastitis test, CMT, is a useful cow-side test for that too. And milk culture helps identify the specific pathogens causing mastitis. But keep in mind, some bugs like mycoplasma require specialized culture media and take longer to grow, so you need to request that specifically.
Good point. What about blood tests?
For blood and tissue tests, we can run hormone assays, check progesterone, prolactin, thyroid hormone levels. We can analyze mineral and vitamin levels, sometimes using liver biopsies for copper or whole blood for selenium. And PCR for pathogens is becoming increasingly important. It's highly sensitive and specific for detecting DNA or RNA from agents like chlamydia, leptospirosis, BVD, and others.
PCR sounds very definitive.
It's powerful, but there's a limitation. Standard PCR cannot distinguish viable from non-viable organisms. It tells you the pathogen's genetic material is there, but not necessarily if it's alive and causing an active infection right now. Quantitative PCR, or qPCR, can give more information on the load, which helps. Other tests might include uterine biopsy or cytology, taking cell samples from the uterus to diagnose subclinical endometritis, that hidden uterine inflammation. And of course, semen analysis if male infertility is suspected.
Okay, that covers a lot of the, let's say, traditional diagnostics. But beyond those, what about the cutting-edge tools, the kind of innovation that's really changing how we approach animal health these days?
This is where it gets really exciting. There's a definite shift happening. Anti-Mullerian hormone testing, or AMH testing, is one. It measures a hormone reflecting the number of eggs remaining in the ovaries, the ovarian reserve. It can help predict future fertility and reproductive longevity, which is incredibly useful for selecting which heifers to keep as replacements.
Predicting fertility potential early on, that's valuable.
Huge value. Then you have sensor technologies. These are truly transformative. Calving sensors, often worn on the tail or placed vaginally, can give maybe an hour's advance warning of birth starting. Studies show they can reduce calf mortality by up to 50% just by ensuring timely assistance if needed.
Wow, 50% reduction.
It's significant. Activity monitors like pedometers or neck collars track movement patterns. They can detect subtle changes indicating illness, like bovine respiratory disease or diarrhea, days before a person would notice obvious signs. And temperature sensors, things like rumen boluses that sit in the stomach, ear tags, even implanted microchips provide continuous body temperature monitoring. They can flag a fever, often indicating disease, up to 2.5 days earlier than visual observation.
Getting ahead of sickness by days, that's huge.
Massive difference in treatment success and severity. Then there's a neat tool called acoustofluidic semen analysis, AD-Meyer. It's a rapid objective method using microfluidics and imaging to assess sperm quality. It's shown really high accuracy, predicting quality with something like 93.7% accuracy. Much better than just looking under a microscope.
Improving the accuracy of bull fertility assessment.
Exactly. And of course, overarching all this are genomic tools. Identifying those genetic markers for disease resistance, superior immune function, better fertility, it allows for much more targeted breeding decisions.
That's incredible. It really feels like these technologies mark a significant shift, doesn't it? Not just in detecting problems, but in fundamentally how we approach herd management. We're moving from a reactive, treat when sick model to a much more proactive, even predictive, predict and prevent model. That's a huge leap forward.
It absolutely is. It's about data-driven decisions and early intervention.
So once we do know what's wrong, maybe through these advanced tools or traditional methods, what are the treatment options? And maybe even more importantly, how do we prevent these issues from happening in the first place?
Right. Treatment is obviously very tailored to the specific cause identified. For antimicrobial therapies, we use antibiotics for bacterial mastitis. Targeted use based on culture results is really encouraged now to combat resistance, and drugs like tetracyclines are used for treating chlamydiosis. But here's a novel approach mentioned in the sources. Using intratortan dextrose, basically a sugar solution infused into the uterus for treating metritis. Early studies show promise, with similar cure rates to antibiotics in some cases, but potentially without disrupting the beneficial bacteria in the reproductive tract microbiome.
An alternative to antibiotics for uterine infections that doesn't mess with the good bugs. That sounds like quite a potential breakthrough for long-term herd health.
It definitely shows promise, needs more research, but yes, it's exciting. Hormonal interventions are also key tools for reproductive disorders. We use hormones like GnRH, progesterone, and sometimes estrogen to induce or synchronize heat cycles for an oestrus. Hormones like HCG or GnRH are used to treat cystic ovaries, and protocols like OVSynch are widely used to synchronize ovulation for fixed-time artificial insemination, improving breeding efficiency.
Managing cycles hormonally.
Yes. For milk letdown issues, oxytocin can be administered temporarily. And as mentioned, recombinant VST is used in some systems to increase overall milk production. There's also mention of traditional non-hormonal or herbal options, sometimes called galactagogues, like goat's rue or fenugreek being explored, though scientific evidence for their efficacy in cattle varies. And naturally, nutritional adjustments are fundamental. Removing any mycotoxin-contaminated feed is step one if that's the issue. Providing toxin binders can help. And then optimizing the levels of protein, vitamins, and trace elements based on analysis is crucial.
Fixing the diet is often job one.
Often is. For dystocia, the interventions are more hands-on. Obstetric interventions range from assisted vaginal delivery, basically, helping pull the calf, to phototomy, which is a procedure to remove a dead calf in pieces if necessary, or performing a cesarean section, C-section. And then there's the absolutely crucial post-dystocia care for both the mother and the baby. For the dam, that means things like providing warm water with electrolytes to rehydrate her, carefully monitoring for retained placenta or signs of metritis. For the calf, it's about vigorous stimulation to get it breathing, clearing airways, ensuring it's warm, and this is non-negotiable, providing 4 quarts of high-quality colostrum within the first 6 hours of birth.
That last point about the colostrum, getting that 4 quarts in within 6 hours,
Yeah.
and how quickly that window closes for the calf to absorb those antibodies, it really underscores how critical timely intervention is in so many of these situations, doesn't it?
Precisely. You cannot overstate the importance of that colostrum window. The calf's gut has specialized cells that absorb those large immunoglobulin molecules, but their ability to do so drops sharply after about 6 to 8 hours and is essentially gone by 24 hours. Any significant delay means compromised passive immunity, leaving the calf vulnerable to disease for its entire early life.
Such a critical, time-sensitive moment. Okay, so that's treatment. But how do we get ahead of this whole cascade of problems? What are the proactive, preventative steps?
Prevention is absolutely the cornerstone. It's always better and usually cheaper than treatment. It starts with comprehensive herd health programs. This means robust biosecurity. Like we mentioned, quarantining any new animals coming onto the farm for a good 21-30 days is key. Strict movement control on and off the farm. Regular sanitation protocols, especially for things like calving stalls, clean them thoroughly between uses. And working closely with a veterinarian to develop tailored plans for the specific farm.
Biosecurity first, then
Yeah.
vaccines.
Definitely. Vaccination programs tailored to the risks in that region and herd are essential. Core vaccines usually cover things like IBR, BVD, leptospirosis, campylobacteriosis, sometimes brucellosis, and clostridial diseases. And it's worth noting again that chlamydia vaccines are available and used in cattle, particularly against the abortion-causing strain.
Okay. Biosecurity, vaccines. Nutrition must be huge for prevention, too.
Absolutely. Strategic nutritional management throughout the entire production cycle is vital. It's not just about fixing problems, it's about preventing them. Maintaining that ideal body condition score may be closer to a 5 or 6 on the beef scale or 3.0, 3.25 dairy scale at calving. Ensuring balanced diets with adequate energy, protein, minerals, and vitamins during gestation and lactation is fundamental. Regular feed testing is important too.
It's genetics again.
Genetic selection offers a powerful long-term prevention strategy. Producers should select bulls known for calving ease, especially when breeding heifers for the first time, to reduce dystocia risk. Ensuring heifers are grown appropriately to reach target. Breeding weights is also management, but has a genetic component. And as we discussed, genomic selection is really game-changing here. It allows breeding for enhanced fertility, improved disease resistance, better immune function, balancing that high milk yield with overall health and robustness. And of course, culling animals with known heritable defects that compromise health or reproduction is part of smart genetic management.
Breeding for resilience, not just production.
That's the goal. Finally, best practices in calving management are critical for prevention. This means having clean, dry, dedicated calving facilities ready with essential supplies. Training personnel on when and how to intervene effectively, for example, knowing to intervene if a cow shows no progress after 1 to 2 hours of active straining, or 2-3 for a heifer. Minimizing stress during that whole periprurient period, the time around calving, is crucial. Even simple management strategies like feeding cows late in the morning or mainly at night have been shown to encourage more cows to calve during daylight hours, which allows for better observation and timely assistance if needed.
That's clever, shifting feeding to influence calving time. What's really fascinating here, listening to all this, is that these prevention strategies aren't isolated actions. They really seem to form an integrated, synergistic system. It sounds like investing in one area, like maybe better genomic selection, yields benefits across multiple aspects of herd health, reducing problems downstream. Is that truly the case?
Absolutely. You've described it perfectly. Think of it like a positive domino effect. Better genetics for calving ease and fertility might mean fewer dystocia cases. Fewer difficult births mean healthier cows starting lactation, which means better milk production, lower risk of subsequent uterine infections like metritis, and better breedback rates. Similarly, improved nutrition boosts the immune system, making cows less susceptible to mastitis and better able to handle metabolic stress. Each piece supports the others. Investing in prevention across the board creates a healthier, more resilient, and ultimately more productive herd.
It really drives home the holistic nature of managing animal health. Okay, so after exploring all these complexities, the physiology, the causes, diagnosis, treatment, prevention, what does this complex puzzle mean at the bottom line? For the producers financially, and just as importantly, for the welfare of the animals themselves.
Well, the financial losses are staggering when you add it all up.
Mhm.
As you mentioned at the start, overall reproductive losses alone are estimated to cost the U.S. livestock industry approximately $1 billion annually. Female infertility is often cited as the single largest economic loss for beef producers, costing around $75 per exposed cow if she simply fails to conceive and raise a calf. Dystocia is incredibly costly. Estimates for the cost per case range widely, from maybe $145 up to $500 per incident, with some reports even higher, maybe up to $380 just for the immediate costs. That includes reduced milk production and the subsequent lactation, potentially 600 to 800 pounds less milk. Increased days open the time the cow is impregnant, costing $150, $300 or more, plus the cost of cow or calf deaths, treatment, extra labor, and increased culling rates.
Huge cost per incident there.
Huge. Mastitis is often called the most common and costly disease causing economic losses in dairy globally. One estimate puts the total failure cost at around $147 per cow per year, averaged across the herd. And remember, subclinical mastitis, the hidden form, accounts for the majority of that cost. Botrytis, that uterine infection often following calving difficulties, is estimated to cost the U.S. dairy industry something like $665 million annually. And abortion represents a significant loss, potentially up to 630 British pounds per aborted cow in UK estimates, accounting for the lost calf and future production.
The numbers are really stark, and beyond the dollars and cents.
Beyond the economics, there are significant animal welfare concerns wrapped up in all of this. Dystocia, difficult birth, is considered by many experts to be one of the most painful conditions cattle can experience. It involves intense pain, potential for severe physical injury like tearing, nerve damage, paralysis, immense stress for the cow, and oxygen deprivation or injury for the calf. Mastitis is clearly a painful, utter infection. Infertility itself can be linked to underlying issues like chronic stress or poor body condition, which are welfare concerns. And just general stress from handling environment or social factors reduces overall welfare and impacts both physical health and normal behavioral development. If we connect this back to the bigger picture, you really see that the economic burdens are inextricably linked to animal welfare. The pain, injury, and stress resulting from conditions like dystocia and mastitis don't just cause suffering. They directly impact productivity, increase treatment costs, and contribute heavily to why cows are culled prematurely. So, improving animal welfare through better management, genetics, and preventative care isn't just the ethical thing to do. It frequently translates directly into improved herd health and better profitability. The two go hand in hand.
That's a powerful connection to end on. Today, we've really taken a deep dive into how lactation failure in cattle is such a complex, multifactorial challenge. It's clearly not just about a cow not producing milk. It's about this profound physiological interconnectedness between reproduction, nutrition, immunity, and lactation itself. It's about the pervasive impact of those hidden subclinical conditions like mastitis that silently drain profit. It's about the absolutely foundational role of precise nutrition and the often overlooked effects of stress. We saw the power of balanced genetics, breeding for health alongside production, and we really highlighted the pivotal event of dystocia and its long-lasting consequences. We hope listening to this has left you feeling far more informed and maybe even a bit surprised by the intricate world of cattle health and milk production. It truly is a testament to how everything in a complex biological system is connected, isn't it? And considering how absolutely crucial timely intervention is for that calf's colostrum intake, that critical first milk, and how incredibly quickly that absorption window closes, it leaves us with a thought for you to mull over. What hidden, time-sensitive windows of opportunity might you be overlooking in your own areas of interest or perhaps in your work, where even a small delay, a missed chance for early action, could have massive, unforeseen long-term consequences down the road?